Handoff communication training. A handoff involves the transfer of patient information and establishing responsibility between providers and departments. Approaches to improvement. Improve communication, improve discharge planning and transitions between levels of care, improve admissions, more efficiency with assessments, treatment plans, and overall patient care. Some questions to consider. Where is the communication failure happening? When are we discovering that information is not being communicated or transferred? Is the failure internal or external? Where is the opportunity for improvement? How will we measure the impact of changes to our communication? How will we ensure continued compliance of timely, accurate, complete, and fully understood handoff information? Tips for handoff communication. Provide handoff in the same order every time. Use verbal, face-to-face communication. Allow two-way exchange. Limit distractions. Allow others to overhear the information. Complete patient assessment prior to handoff. Include the 5 Ps: patient name, problem list, plan of care, purpose of plan, and precautions. More tips for handoff communication. Use clear language. Incorporate effective communication techniques. Standardize. Create smooth handoff between settings. Use technology to your advantage. Using mnemonics. I pass the baton. Introduce yourself, your position, to the patient. Patient. Name, identifiers, age, sex, location. Assessment. Presenting complaints, vitals, and symptoms/diagnoses. Situation. Current status or circumstances, recent changes, or level of certainty. Safety. Concerns, labs, allergies, alerts like fall, isolation, and suicide risk. Background. Previous episodes, medications, and family history. Actions. What actions were taken or are required? Timing. Level of urgency, prioritization of actions. Ownership. Who is responsible? A nurse, a therapist, or someone else, including patient responsibilities. Next. What needs to happen next? Anticipated changes or contingency plan. What are the barriers to communication? Are we communicating effectively? If not, what are the most effective ways to share information? Is the message clear? Do I have to search for the information, or is it in a place where it's easily recognizable? Are we exchanging the right information? What type of information is pertinent and what is not important? How do we improve handoff communication? Coach patients on medication self-management, use of patient-centered language in their chart, importance of follow-up with physicians and clinicians, knowledge of red flags or signs that the patient's condition is worsening and what to do. Use Teachback to assess the patient's understanding of discharge instructions and self-care. Include other providers, family, and community caregivers as full partners in assessments and predicting community needs. Proper discharge planning. Treatment team participates in discharge planning, nursing, case managers, and therapists. Discharge planning begins the day the patient arrives. Treatment team meets regularly to discuss progress in the patient's discharge planning, specifically identify readmission risk and factors those into the discharge plan. Provide customized real-time critical info to the next care provider, specifying the process in detail, the content, sequence, timing, and responsible person for each step. Establishing connections between each step, designing a pathway that's simple, continuously assessing outcome and striving to improve. Where to start? Assess high-risk areas. Analyze processes associated with those areas. Look for potential areas of failure. Seek improvements to reduce failure likelihood. Overview of handoff communication. Make connections with the next level of care or post-treatment supports. Emphasize the we in each person's journey to long-term recovery. Let them know that there are individuals and organizations that can help them to sustain their recovery, and wherever possible, establish personal connections for internal and external referrals. Establish clear two-way expectations and communication between levels of care. The guided tour. Encourage and empower patients to meet with individuals and organizations providing ongoing recovery supports before they leave the facility through participation in the next level of care or recovery support groups prior to discharge. Streamline paperwork. Streamline the paperwork process between the referral source and the outpatient program to eliminate duplication of effort. Overlap levels of care. Overlap outpatient treatment with inpatient treatment from the referring level of care, so patients have the opportunity to experience outpatient care before being discharged from the referring level of care. Blend levels of care. Blend other levels of care with the outpatient treatment so patients can develop therapeutic relationships and familiarity with outpatient patients, therapists, and locations before moving to outpatient care. Orient clients to treatment. Provide orientation for both inpatient and outpatient treatment before admission and prior to discharge from a level of care. Orient clients to treatment. Provide orientation for both inpatient and outpatient treatment before admission and prior to discharge from a referring level of care. Providing a patient with orientation empowers them to know exactly what to expect from the treatment process and their providers. Summary. Offer a tour guide. Overlap levels of care. Blend levels of care. Include family and support circle in discharge and admission planning. Use motivational interviewing. Use video conferencing. Map out continuing treatment. Orient clients to treatment. Offer telephone support. Follow up before and after patients' appointments post-discharge. You're now ready to take the quiz on Handoff communication training.